Okay, today is your first day of ballet. You will be first learning about the muscles that are used, some stretches, and what we should eat, and maybe a few dance moves.
So what muscles do we use?
Well, the most common muscles we use in ballet are our quadriceps, hamstrings, hips, gluteal muscles, calves, feet, and back core muscles. These muscles can also be injured when performing dances if not used properly or stretched properly.
What injuries can we get from dancing?
Well, some of the most common injuries is runner's knee. Runner's knee means that you have a dull pain around the front of your knee and the patella. And runner's knee may be caused by a structural defect or walking a certain way or running a certain way. Sprained ankles can also happen, and later in life, some dancers may develop arthritis.
Foot and ankle injuries. The Achilles tendon injuries. The Achilles tendon is a fibrous band of tissue that links the muscles in your calf to your heel. Your Achilles tendon withstands a lot of stress and pressure during everyday activities, as well as during athletic and recreational play. Tendonitis might be due to overuse or damage to the area. Muscle injuries. Hip injuries. Hip impingement occurs when the femoral head or the ball of the hip pinches up against the acetabellum.
How do you train so you don't get hurt?
Cardio is very necessary to improve lung capacity and to build up endurance so a dancer can perform properly. Core work is mostly to help protect lower back muscles. Most used workout is a 30 to 60-second plank and arm and upper back strengthening is also important. But most importantly, you should stretch and warm up your muscles so injury does not occur. Some stretches include stretching your hamstrings by putting your legs out and trying to touch your toes. Then you should stretch your feet by sitting in the same position as the previous and relaxing and flexing your feet and also rolling your ankles in circles. You may also want to stretch your calves by using a ballet bar or a chair. But if you don't have these, you can lie on your back and bring one leg towards your face, and then hold for 30 seconds and then switch legs. Another important stretch is your back muscles. So you will stand on your feet and shoulder width apart and touch your toes. And then you should always practice your splits. And to practice balance, you should always do pirouettes.
Wow, that's a lot of stretching. What should we eat to be healthy?
Well, a healthy calorie count is between 1850 to 2,000 calories a day, and any less could be malnourishing and can cause you to be very fatigued. Some of the foods that would be beneficial to eat are whole grains, eggs, yogurt, fruit, fish, lean meat, granola bars, and things with a lot of protein and fiber. You should always stay away from carbs and processed sugars and unnatural fatty foods. Any more questions?
Yeah, how do our muscles interact and help us move the way we need to?
Lower back muscles. Erector spinae, which collects along the spine and consists of many muscles, the iliacostalis, longissimus, and spinalis. They all work together to extend the spine. Serratus posterior begins at the 11th vertebrae and runs sideways and upwards in a rectangular shape. Acts to pull the lower ribs back and down. Lastly, latissimus dorsi stretches from the top of the neck side to the pelvis all the way up to the underarm. Function is to extend and laterally flex the lower back and rotate shoulder joints. maximus, which connects to the iliotibial band and stretches to the lower back, helps rotate the hip. Gluteus medius, which is a four-sided muscle located outside of the pelvis, helps abduct the thighs as well as to support the pelvis when weight is shifted from one leg to another. The gluteus minimus, which is the smallest of the three gluteal muscles, assist in the abduction of the thigh, mostly when weight is shifted from one leg to another, and to rotate the thigh inward. Muscles. External oblique is the largest of the three flat muscles in the side of the abdomen. Pulls chest forward and downward, which compresses the abdominals when arching inwards. Internal obliques, located just below the externals, contract when the diaphragm expands and pulls the rib cage in the abdomen towards the hip and lower back. When the side bends, rectus abdominis, the middle six-pack, its function is to flex the lower back. Iliopsoas, composed of the psoas major and the psoas minor, and iliacus, it is the strongest of the hip flexor muscles and acts to flex the hip. Lateral rostral, these group of muscles work to rotate legs from the hip sockets into a turnout position. Other muscles that make this up are the piriformis, humerus superior, obturator internus, humerus inferior, obturator externus, and the quadratus femoris.